Mother Knows Death, starring Nicole and Jemmy and Maria QK.
Hi everyone, welcome to Mother Knows Death. Today we are going to be talking about a nurse influencer who tragically died during childbirth, Russell Brand's rape charges, at least 5 nurses working at the same unit that all have brain tumors, discounts for skinny people, a man who performed surgery on himself, and of course, sex in a cemetery. All that and more on today's episode. Let's get started with Nurse Hailey's tragic death.
Okay, so Hailey Okula, she was a popular nurse influencer. Her handle was @RNNewgrads. So she was pregnant with her first child. She had told her audience about her fertility struggles. So, of course, everybody was really happy for her when she announced that she's pregnant with her and her husband's first child. So last week she was due, or she started going into birth. She went in the hospital, and then her audience was shocked when her husband posted a couple days later that she had died during the childbirth.
Yeah, I mean, we personally have dealt with this experience that one of our great family friends died after giving birth to her son. This was back 11, 12 years ago now at this point. But yeah, I mean, it's really, especially since that happened to us, I know exactly what everybody in her life is going through. And I guess it's just even more shocking because she was an Instagram influencer. She had almost 500,000 followers, so a lot of people were following her story for years. And it's just upsetting to anyone that hears that because nobody wants to hear. First, people are just like, it's 2025. How does that even happen? But it happens, unfortunately, about 1,000 times a year in the United States and even more in other countries. It just, sometimes this particular condition that his wife was diagnosed with, it's just like you can't know that it's happening, and sometimes you can't stop it from happening.
Well, what happened exactly in her case?
So she had something called an amniotic fluid embolism. So we've talked about embolisms all the time on this program. Usually we talk about a pulmonary embolism. Sometimes if we're talking about like liposuction, sometimes these plastic surgery deaths we talk about, it would be a fat embolism. And that just means that something is starting at one point in the body and it's moving through the vascular system and can go to another part of the body. So in this case, it is the fetal cells that are present in the amniotic fluid are somehow getting into the maternal blood supply and traveling to the lungs. And this is what is causing these women to just suddenly get these symptoms and their heart stops and then they start. So the weird thing is about this is that embolisms, when there's death from embolisms, either from fat or from blood, they usually have this certain way of presenting itself. And with amniotic fluid embolisms, it's a little bit different. And that's why sometimes it's referred to as being closer to like an anaphylactic reaction that you would think when a person with peanut allergies has peanuts or something like that. So what happens is it's the blood vessels start tightening up really tight and the bronchioles start tightening up. The airway and the lungs start tightening up. And not only are they just getting irritated because these cells are within the blood vessels and are traveling into the lungs, but it's releasing these inflammatory cytokines that are reacting to this foreign material being present inside of the mom. And that is leading to, it activates coagulation, which is blood clotting, and it leads to a condition called DIC. DIC stands for disseminated intravascular coagulation. It just sounds crazy. And it's this really bizarre condition where the blood clots too much and then people end up bleeding to death, which it's kind of counteractive. It doesn't make sense. But let me explain it to you really quick because it makes sense. So what happens is all of the blood starts clotting and it could block off all of the oxygen to the organs. So that's the first problem really that you're having problems with, is all these blood clots. But then the rest of the blood no longer has access to any of those clotting factors such as platelets, because they're all being used by the clots that are being made. So that blood just can't clot at all. And then the person ends up just spontaneously bleeding. And it's this really fast thing that could happen to women during childbirth. From the time it starts, they could be dead within an hour. It's really quick. And unfortunately, it's so rare that many physicians don't see it in their lifetime. And it's something that you have to really be on top of. You have to recognize, jump on top of. And even in that case, you still might not be able to save the person. But there are people that do survive it.
Yeah, because I guess my question is just like, there's nothing you could do to prevent this, right? It just it
There's nothing.
happens.
I mean, there's definitely risk factors associated with it. And there's a lot of risk factors associated with it. And if I really listed all of them, I think every single person that's ever had a baby could say they have one of them.
Yeah.
So it sometimes happens in people who have multiple pregnancies. So if you have twins, right? Okay, well, that's a lot of people. Advanced maternal age, that means over 35 years old. That's a lot of people. There's all these different risk factors. Well, one of the biggest ones is when a person has a condition called placenta accreta, which is, so normally when you have the baby, you have this placenta grows inside your uterus, and then there's this tissue, this layer in between the placenta and the inside of the uterus. So when you give birth, the placenta is supposed to just kind of fall out and slide out really nicely. But sometimes that doesn't happen, and sometimes the placenta could grow into the uterus almost like a tumor. But it's not a tumor, it's not a tumor. But it just has that kind of thing that it's growing into it like that. And those people are at the highest risk for this. They have like a 10-fold increased risk with it. But again, lots of women have this condition and never develop an amniotic fluid embolism. So it's hard to say, but she did have this history of IVF. It does happen in 8% of patients that have had 8% of the cases are patients that have had IVF. I still wouldn't even really consider that to be, though, like a risk factor, because how many people get IVF and have no problems? So this is just one of those things that it's so scary. 1,000 people a year die during childbirth, and this is actually not even the number one cause of death in these patients. But it's something that you kind of walk in there knowing, maybe like speak to your doctor and just say, hey, are you aware of what symptoms present? Because you're seemingly like pretty fine, and then all of a sudden it just goes downhill really fast. Your heart stops, and there's some kind of confusion that could be presenting, like a disoriented. There's different things that the doctor could be like, wait a second, like what's happening here? Also, the scary thing though is that this is not like, this is one in a list of all 50 other things that could happen to you while you're having a baby. So sometimes the symptoms kind of cross over each other with other conditions. And listen, like, people think just because so many people get pregnant and have babies that it's just this thing. It's not a benign condition. It puts a lot on your body. It makes you immunosuppressed. You have more blood in your body than normal. It's harder on your heart because of that. Like, there's just all these different things, and people get very surprised when things like this happen. But like, 1,000 people a year out of the millions of people, women especially, that are childbearing age in this country, it's just like, it's not that much, and it's nothing to freak out about or not get pregnant because of.
Yeah, and on the subject of IVF, it had me wondering, if they have multiple embryos that are in storage right now, do you think he would consider using a surrogate to have more babies, since they're already created, and then all his kids could be full-blooded siblings?
I know we've talked about that before on here. Is that something that is legal to do here?
I mean, it seems...
Because I remember we were talking about it, but I thought it was in another country, honestly.
Well, the case we talked about before was, I believe, a woman's husband had died in a car accident, and she wanted to have his sperm extracted after his death.
That's like a totally different thing. Yeah, he honestly probably can use them legally because they're his. I'm not 100% sure of the law regarding that? It
Well,
would
it
be great
seems
if anybody knew that.
Yeah, I did a little bit of research on it. So it seems like it depends where you live and what your state's laws are in this country in particular. And it seems like in most cases it would require some written consent. Based on my research, it appears that fertility clinics will kind of like cover this in your paperwork of what's to happen with the embryos over time, and if I assume when you do it that both people in the couple will need to consent if they're going to be destroyed after a certain amount of time or if you get divorced. I know I had talked about this before with Sofia Vergara had been in a lawsuit about her ex-husband trying to use embryos they had created, but she did not consent to it. So I guess a large part of it is written consent. And there was a really big case in the UK with this, actually. It's called the Jennings versus Human Fertilization and Embryology Authority case. So that is where a court ruled that a widower could use an embryo created with his late wife, even though she hadn't provided the written consent.
Oh, yeah. Well,
So,
I mean, yeah, I am interested. I mean, how do you even know this?
well, I looked into all of this because
No, I
Oh.
don't mean this. Like, how do you even know that there's more embryos?
Well, I think when you're going through IVF, after they do the egg retrieval, you are privy to how many they have created, and then they do fresh transfers, or the remaining ones will get frozen that you could get implanted.
Yeah, but
at a
I'm
later
saying
time.
you're not. I'm saying like, how do you know that this couple has extras?
Oh, I don't know this. I'm saying I was
you're just
curious.
like assuming if there were extra. Okay,
Yeah,
I just
sorry.
was like, that would just be. It just would be a really weird thing to talk about in an interview. It's like they're not. I'm sure that's the last thing from his mind right now.
No, it's none of my business. It's just something I was
No, it's
curious
curious,
about because
yeah.
I know in these cases, a lot of times you end up with multiple embryos. And of course, that's because sometimes they don't take and then there's extras to use for multiple rounds of IVF. But I'm just wondering in the case of if somebody did have extras and their significant other died, what the legality is or the desire is to go forward and use those.
Yeah, well, that's actually a really interesting case because do you remember the hockey player what's his name,
Johnny
Gaudreau?
Gaudreau.
Yeah, like his wife just had the baby yesterday or something, or
Yeah.
within the past couple days. It's just really, it's just like so sad to think about having a pregnancy and giving birth to a baby that the parent that you made the baby with is no longer alive. But people do it. So yeah, and this case just bummed me out so much. I mean, she's like a fellow fire wife. Her husband's a firefighter, just like my husband, and she does kind of what I do. Like, she educates medical professionals. She started a whole entire program educating nurses, and so it's scary because like I 100% guarantee you that she knew about this condition because we all learn about it in school. And it's always, every single person that knows about this condition, it's always on your mind when you go into childbirth, all of the possible thousands of things that could go wrong. And you just have to think like if she was still alive, like what would she think of this? It's just like a really, just as you would say if something like that happened to me, like, because I talk about it all the time. It's kind of just like a really crazy thing. And I feel terrible for her family. Like I said, this happened to one of my best friends, and her husband had to leave the hospital with a baby too without his wife, and it just is freaking terrible.
No, it's unimaginable. I just think of like what horrific luck that you already have to go through the struggle of infertility and how emotionally draining that is, and then you finally have this like miracle baby, and then it just ends up in tragedy anyway.
Yeah, I mean they'll be fine. They will be fine. Just it's just like right now, the next couple months are just going to feel like the absolute end of the world, but like life goes on and they'll be fine. So what do you think about this Russell Brand story?
I mean, I wasn't really shocked when the news broke that he had been charged because I know 2 years ago some news had been floating around that he was being investigated for sexual assault. So I guess I kind of forgot about it because it's been a little bit of time, but I don't think this was particularly shocking for me as somebody that follows pop culture. But what are your thoughts on it?
Well, I don't really know much about the dude. Like, he used to be married to Katy Perry or something. I just don't really, I don't like follow what he's doing. I don't know.
I mean, I believe he started off as a stand-up and then he just became this TV personality. I know him because he's in my favorite movie ever, Forgetting Sarah Marshall. He's just this comedic
I never
actor.
saw that. I never saw that.
Oh my god. I don't know if you would find it particularly funny, but I've gone over this many times. I think it's my favorite movie
So
ever.
he's like an actor or
He's
a
an
comedian?
actor.
Okay.
He's like an actor in this like British personality. He's this overly eccentric, very sexual man, always like hip thrusting and whatever. So yeah, he was married to Katy Perry. I think he's now married to an author. He's been married to her for a couple years. He was only with Katy Perry for I think like 2 years. In celebrity world, that's 5 minutes. You know.
So he has a history of these accusations.
Well, I don't know about a long-term history of the accusations, but I know the accusations first started surfacing a couple of years ago, which seemingly prompted this investigation that has now resulted in charges.
So now this investigation, like this, the only thing that I have questions about is the year that these particular incidents took place.
All right, so the alleged incidents happened from 1999 to 2005 involving 4 women, but he has been charged with 5 counts of rape and assault. So they're saying it's 1 count of rape, 1 count of indecent assault, 1 count of oral rape, and 2 counts of sexual assault. And these are just, I believe, incidents that happen in the UK.
How did they find these women? They came forward?
So it looks like these women came forward in the last couple of years to a media outlet, which of course is providing a lot of scrutiny as like, you know, if these incidents happened nearly 2 decades ago, why are you just coming out now? And why are you going right to the news? And I am going to defend them because I just think in these cases a lot of times, I'm going to use Megyn Kelly as an example because I've recently read her book, and we all know my favorite type of drama is newsroom drama. So when everything that broke with Roger Ailes happened, I was all over it. But for example, with Megyn Kelly, so she had experienced inappropriate actions with Roger Ailes while she was working at Fox. And at the time it happened, you know, she was, of course, worried it was going to impact her career. And she started putting feelers around the office to see if anybody else had had this experience with him. She even at one point brought it to management, who kind of blew it off as Roger Ailes was just infatuated with her. So after putting feelers out and talking to a couple of her colleagues about it, she decided, you know, I don't want this to affect my career overall. I don't want to be like a shit starter at my job. So I just want to like kind of make it go away because she was embarrassed that it even happened, even though she denied all of his advances. So then, you know, fast forward years later, we have this lawsuit by Gretchen Carlson that's exposing this huge problem going on behind the scenes. And then we find out there's many victims, but the victims had gone back for decades. So of course, everybody's quick to jump on and blame the women for not coming forward. But there's a lot of concerns when you're dealing with men like this.
Yeah, and I understand what you're saying for sure, but I'm always skeptical as well. Like I'm not like a, you know, believe all women thing. Like it could be, I want to go on a case by case basis of what's happening.
Well, I think that's important, especially with everything we're seeing with Blake Lively right now.
Yeah, well, exactly. And that's why I feel that way. I don't know, like I look at it right now, like 1999 to 2005 was just such a long time ago. And I think about, like, let me give you like an exact example of something that happened in my life. Because I think if you talk to every single woman, really, like they have some kind of experience of some kind of sexual, I wouldn't say like assault, but just maybe, well, you would consider it sexual assault now. Like people at your job, like I'm going to use an example of like someone grabbing my ass or something like that, right? Like I started working when I was 14 years old at a bakery, right? In like underground bakery, like under the table, whatever, right? And like there were guys working there. I was 14. There were guys working there that were like older than me, and they would like come up to me and grab my ass. And like this one guy like grabbed my ass like really hard and like stuck his finger kind of like as far as he could with my pants on, you know? And like whatever. I stopped working and I was just like, ew, get off me, and like slapped the guy off of me, and that was the end of it. Like it was nothing, right? It's totally wrong that happened. I 100% agree. Like if that happened to one of my kids right now, I would go down there and like punch them in the face and get my anger out on them before I would even call the police, right? But like now, okay, so now, right? I carry that with me. Like I don't really consider that to be like as intense as like other people's experiences, and I don't know what these women's experiences are or whatever. But like it's just kind of like whatever, that guy was an asshole, blah 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 blah, move on with my life, right? So now like in 2025, like am I going to go and try to figure out who that dude was and like get him arrested and whatever?
Well, I think you might be inclined if you're constantly seeing his face on television and in the press.
But that's my point. I might, because the guy's got money and I
Well,
want to
I'm not
like
saying
take
'cause of
down a
money. I'm
famous
saying the
person.
daily reminder of something bad that happened to
No,
you.
because I like I'm over it and I've been over it. Like it's just like I'm not like living as a victim of it. I'm just saying it's a memory I had from when I was younger. But like now let's vice versa and say like I was working on a movie set and that guy so happened to be Russell Brand. Well, like isn't there something in it that like people go after him because of who he is, because he's got money, because he's famous, because they want to take him down because they're jealous that he has more than they do? Like there's all this other angle to it, because the guy that was working at the bakery in his 20s or 30s that was involved in my case, like he's probably like a loser right now. Like why would I even bother? Why, like that's how I look at it. Like you don't hear about these accusations coming out on regular everyday people because there's nothing to get out of it besides money, which
that's a lie, because it does happen with regular people, but
you
it wouldn't be in the press.
know a regular person that's just living around here right now that's going to jail for something that they did 20 years ago like that. No,
I'm just making the point.
It's
I
always
understand
famous
what you're
people.
saying, that there are plenty of people that make things up and go after celebrities.
I don't even
But
necessarily
there are plenty
I
of
don't even
people
necessarily
that are
think that they're making it up. I'm just kind of like, dude, like it's just I just don't, I don't know. Like I don't like this, like all of a sudden all these people come out of the woodwork. Like where the fuck have these people been for 25 years?
Because, like, you're missing the point of my story with Megyn Kelly, is that it happened to her, I believe, in like 2006, and she couldn't come out for a decade because she had actively tried in 2006, at the time it occurred, to try to get around it and figure out how to get out of the situation and hold him accountable, but she was not able to do so until many other women came out later.
But why are they going to the news then and they're not going to the police?
Because some people go to the police and they don't do anything, so your only option is to go to the news. I'm telling you,
I'm sorry. Like we could disagree on this. Like I just think it's like it's just kind of like whatever, dude.
You have every right to be skeptical. I mean, people certainly come forward with false accusations, but I think it's important to look at like the amount of people. It's not one person. Like, look at Blake Lively and Justin Baldoni, for example. There is not one other person coming forward saying Justin Baldoni sexually harassed them. And that's where it makes a gray area, because there's not enough claims to back up what Blake Lively is saying. So, like, when you look at this case and there's a 2-year investigation and there's 4 women involved, you have to start thinking about it.
This is why, like, and you sit there and say, well, women can't come forward and stuff. Like, women can't come forward because of the Blake Lively situation. And
well,
like,
I know that,
but
because
but
people
like,
make shit up.
And like, if that turns out, like, after they go to court and stuff, to be like true, she should be ostracized because of that. Because this is why, like, people like me, or even too, are just kind of like, okay, here's another one, because it's just like there's a certain level that, like, you don't even want to hear it anymore, because it's just like, oh yeah, it happened to you, whatever. Like, I don't know.
Yeah.
I'm like, the years are just bothering me, because, like, dude, in 1999, it was like a year after I was done working at Hot Topic, and like I literally was working at the mall and like getting ready to go to college, and like it's just so freaking long ago. I can't even imagine that it holds.
The point I'm trying to make is that at the time, this woman may have gone to somebody and told them, and nobody did anything about it, and it kept coming back up. So she eventually felt her only way to like get a hold on it was to go to the media to expose it, because that does happen a lot of times. But there is also a world in which these people could be totally making it up to get a nice fat paycheck. So I don't think in the UK they're getting a paycheck because it's criminal charges. He's facing a civil lawsuit in the United States right now. So, like, I don't know what's going to result in that. And it seems
they get the paycheck from the newspaper that they brought it to.
Yeah, like, not all newspapers pay. So, like, you don't know. It's not all newspapers pay. That one might have, but you just really don't know. It's like he said, she said. You just don't know.
Guys, we are so excited that we have hit over 1 million downloads, and we are having a giveaway to celebrate.
Yeah, so you guys can enter for a chance to win 1 free year to the Gross Room, a signed copy of Nicole and Jemmy's anatomy book, and a Skull Giant microbe. All you have to do is head over to Apple or Spotify and leave us a review, or head over to our YouTube channel and subscribe, screenshot your submission, and send it over to stories@motherknowsdeath.com. You guys have another week to enter the contest, and then we will be announcing winners the following week.
All right, so let's start with this case of the nurses that are working on a maternity floor in a hospital. They all work together, and they all somehow have brain tumors.
Yeah, so this is happening at this hospital in Massachusetts, and 5 of these nurses have come up with these benign brain tumors, and 6 other workers at this same hospital have come up with other weird health situations.
So the other weird health situations don't really alarm me as much because talk to every one of your friends. Everybody's got a weird health situation. That's like why we do this podcast, right? All of these people had benign brain tumors, right? Which is good. At least they didn't get brain cancer. But the interesting part of this is that there were 5 different tumors, but of those 5, it was 3 different kinds of benign brain tumors. So there were 2 meningiomas, but there were also other kinds of brain tumors, including probably, I would say, just based upon most commons, like an acoustic neuroma, or also I would say like a pituitary adenoma. Now, the reason that it's important that there's these different tumors is because, like, meningiomas, for sure, I would say definitely have an increased risk with something like radiation exposure, so do acoustic neuromas. But, like, pituitary adenomas, they don't really, they might not. So it's like, there's hard to see, like, a correlation between, like, pathology versus, like, what they were exposed to in that case. So that's what's, you know how it's like very interesting at a job, because the most famous job related pathologies would be like asbestos, right? Mm-hmm. And it's very easy to see like they have this very specific pathology and they have mesothelioma and it correlates to asbestos exposure. Whereas these are like, they didn't find anything when they were testing. So the health, the occupational safety on the state level came in and did a bunch of testing. They found nothing. And they're trying to correlate it to, they didn't say the other health diseases that the other people are suffering from, but they're trying to correlate both of them. And they're like, there's nothing here. Now, like I said, it's very, I guess it's possible in some kind of world that it is, that they all just so happen to have a brain tumor. I think a lot of people, I know 2 people in my immediate family that have benign brain tumors that didn't even know they had it. Right?
Well, so me, because I have a pituitary adenoma, but I was under the impression that it was just a genetic weird thing. Like it wasn't from an environmental exposure. That's how I understand.
It's not 100% certain of that, but it doesn't have a strong link like other things do. Now, like I'm saying, like you had a brain tumor. We don't know how long. You didn't even know it, right? My father-in-law gives me his scan for something. I don't even know what he was getting done, somewhere on his head and neck. And it's like, oh, there's a 1 centimeter meningioma in the frontal lobe of your brain. And I look at him and I'm like, did you know you had a brain tumor? And he's like, no. And it's like a huge joke in our family now because we're like, that's what's wrong with you. You have a brain tumor, right? So anyway, like we were just joking about that. But like people have things anyway. But I'm assuming that if all these people got testing done, like they must have been having symptoms because otherwise, like how would you even know that you had it, right? And I had a similar situation at my last job, and my old coworker Jess can talk about this with me. That we were working in a newer hospital, and the ventilation system for the lab was bad. It was just really bad. And obviously, in the pathology lab, we deal with formaldehyde mostly, alcohols too, but like formaldehyde is the biggest one that you don't want to be breathing in. And we constantly like had burning face, burning eyes. The thing didn't work. And then it was weird, like at lunchtime, we would smell the exhaust from them making burgers in the lunchroom that was way far away from our lab, so strong. We were like, something's not right with the ventilation system. And we brought it up. We had all of these people come in all of the time. It was just so ridiculous. And people were just like, oh, we can't find anything. We can't find anything. And it's just like, it's just total bullshit. So I feel terrible for these nurses working on the floor because they basically are just told like nothing to see here, move on. And just because they didn't find anything doesn't mean that there's nothing there. So they brought up lots of different things that could possibly they had concerned about. They were wearing a mask like 24/7 during the pandemic. So and of course, like the CDC and all these people are saying that there's no correlation that causes brain tumors, which is possible, but like they also don't really have any long-term studies of people wearing a mask for years and years in a row because that's not what it was designed for ever, right? So they don't have that evidence yet, and it might just start rearing its ugly head now. Those things have chemicals on them. I'm sorry. Like, and if you have them on your face all day, they definitely cause irritation to the skin. Sometimes they've caused other people problems. So like, I wouldn't 100% rule that out. They had to use some other kind of chemical to decontaminate the N95 mask during the pandemic as well. Now they've ruled that out and said like, no, that's not happening. They checked the drinking water. They said it was fine. They said that there were x-rays done, 668 within the past couple years on that floor with a portable x-ray machine. And they said even if a staff member was present for every single one of those x-rays, they still wouldn't have been around enough radiation exposure to cause a problem. Apparently there's a pharmacy below the maternity floor that's using ventilated systems for some kind of chemicals that they're working on there. So they've ruled everything out, and now all of these people are working on this floor, and not just the nurses, but all the staff that are working on the floor are left with like, now what?
I don't know, and I wouldn't accept this because I do think I understand you're saying it's like multiple forms. It's not like everybody has the same exact kind, but it is eerie to think about, and they must have been having symptoms. I don't know. This just bothers me because I'm thinking like I only found out about my thing because I was getting blood work for something totally different and it came up. And I just want to tell this story really quick. So like I get my blood panel back and I'm reading it, so I see like my prolactin's high, and then of course I'm like Googling it and it's like, oh, you might have a brain tumor, right? So I'm like, classic WebMD, I'm just gonna blow it off. So then I send it to you, and you're just so casually like, you have a brain tumor, it's fine. And I'm like, what are you talking about? But it really is fine.
Did you want me to like put your head on my bosom and like hold you and tell you it was going to be okay? Like, it's not cancer. They could treat it. You're fine.
Your delivery of your medical diagnosis is like insane. It's why we call you Dr. Death in the family.
If it was serious, I would have been a little bit more. It's just like, listen, like I'll tell you when there's a problem. Trust me. It's just,
believe me,
not.
I know you.
And
will.
look, you're alive, so I was right.
Well, it's like really, in my case, it's really not a big deal at all. But like for these people, I wouldn't be comfortable with this investigation just being like, you know, there's nothing wrong. And it seems like the Massachusetts Nurse Association is also saying that their testing was not comprehensive and they're going to keep pushing for more. Yeah, and apparently the federal level of OSHA is not even aware that this is going on. So I would hope they're going to, like, the big guns are going to step in and try to.
There was some, I didn't look this up because I just thought of this. I just thought of this right now. But do you remember that there's like all of these cases of weird cancer. I think it's actually brain tumors too, being linked to the vet in Philly, our old Phillies and Eagles stadium.
Yeah, at the
Like,
veteran stadium.
Every single person that had these tumors was either like they worked there, or they linked it all back to there. And I don't. We should actually like do a deeper dive into that, because I'm interested in that. Like,
I
maybe
believe-
for a high profile death dissection.
I believe John Kruk had a cancer that was related to the turf field from the veteran
Yeah, it was
stadium.
something about the turf. And then remember they were selling the turf
on eBay.
on eBay, like, for a memory, and I was just like, yeah, no thanks, I don't want that in my house.
Yeah, no.
Which, whatever, like, in a glass case it's fine, but it's just like bad juju or whatever. All right, let's do a high profile death dissection on that, because I like that kind of stuff.
Yeah.
Have you heard about these tattoos that are apparently they're like semi-permanent tattoos?
Well, I've seen them circulating on social media, but I just assume, like most things I see on social media, that it wasn't true, or people are just idiots for like not understanding how tattooing works.
I don't know, like, I don't know where the hell I've been. I just, like, this is the first time I've heard of it. And so I'm looking into it, and it's like they're doing a normal tattoo, except they're using this other kind of ink that is supposed to be able to be removed from your body easier. And they're tattoos that are done that are only supposed to last a year to 1 to 3 years, and they're just supposed to fade away. I mean, I can't, like, so tattoo artists are doing this on people? I mean, I guess so, if they're getting paid either way, right?
Well, I guess this company called Ephemeral Tattoos created this specialized ink that is designed to fade over time. So it's this like, I guess it's on some level considered this temporary tattoo.
This is the dumbest shit I ever heard in my life.
But I'm thinking, like, why would you want to sit through the pain of getting a tattoo if it wasn't going to be there forever? It has to be causing scar tissue. So are people getting it thinking, like, oh, maybe I'll like it and it'll go away and I'll just get another one right on top of that same exact area?
I guess in their testing and in their theory, they think that if the tattoo artist delivers it in the exact sweet spot of the dermis, so not the epidermis is the top layer, and then the dermis is below that, and the subcutaneous is below that. If the tattoo artist puts it in the sweet spot, that's how it should last the amount of time they say, and it should go away. It's just so against. This is why, like, I wish I could just take off all my tattoos and not be associated with the culture anymore. I just, like, I hate it so bad. It's just so different from what it was when I started back in the 90s, that, like, I want to be as far away from it as possible, because this is just so dumb. And I was telling you this in the car yesterday too. Like, I saw that there was some, I don't know if it was Shark Tank, but it was some kind of company that's making a machine that you could put pictures into and lay under it and have the machine tattoo you, and you don't have to have an artist draw it and do it on you and stuff. And I'm just kind of like, okay, I'm over the tattoo thing. Like, I'm just over it.
I mean, that machine is absolutely idiotic.
But this is idiotic too. Like, just why wouldn't you just get one of those henna tattoos or a sticker and just put it on if you weren't ready for the commitment? I don't know.
So,
and what did you think? Like, when it says it's made to fade away, like, what did you think the faded away tattoo was going to look like? I'm just curious.
I don't think anybody that they interviewed or the people they were sourcing for this article that had this tattoo done, I don't think any of them realized exactly what that was going to be, because it seems like when the company first came out, they were saying that tattoos were going to last 9 to 15 months. And then they sent out like an update email that actually they might last up to 3 years. And these people that were interviewed for this article were saying that it did look like a nice fresh tattoo for the first couple months. But then as it started to fade, it looked like they had a botched procedure done, so to speak, or that they had some really shitty lasering done. And the craziest part of this is one girl did go to get it lasered, and the lasering place said, we can't do it because that ink's not FDA approved to get lasered off.
I love that. She's actually, yeah, that girl that got interviewed is actually like, the semi-permanent tattoo is actually worse than if I just got a real tattoo, because I'd at least be able to get it removed. Like, think about that. it's just like, listen, it's just like a marriage, right? Like, you really shouldn't go into it thinking that you're going to get out of it right away,
Well,
right?
shockingly, a lot of people do. So, like,
Well,
we know.
I guess that's why this makes sense then. I don't know. I'm curious. And this company, it's interesting for me because I'm sure they've made a ton of money off of this. But like, and the reason that I brought up the application is key because if you put it more superficial, it's not going to last as long. And if you put it into the subdermis or the subcutaneous tissue, like, it's going to last way longer than 3 years. So my whole thing is like, you're just giving this product to people to use and like putting your name on it, and if it's not applied right, like, people are going to have a problem. And I feel like that could almost be, I mean, it could be lawsuit worthy because according to what I looked at their website, they were just kind of like, yeah, this is definitely going to be gone in 3 years. It didn't say like results may vary. They're like pretty certain it's going to be gone.
It seems like now they're saying that results may vary depending on the person. But like you're saying, they have to put it in a sweet spot. So you have to use a special tattoo gun that doesn't go.
No, but like every tattoo artist is supposed to put it in a sweet spot. But like ultimately, like, that's a microscopic level. And if you're a good tattoo artist, you know what it feels like to be in the right area. But I've certainly gotten tattoos. If you get blowouts, it goes too deep. Like, it doesn't go deep enough. How many times do you get tattooed and you just like have to go back and get it touched up? Like, and this is like normal stuff when you get tattooed all the time by different artists and everything like that. But it's very hard. Like, tattooing my skin versus tattooing like a man with thick and like an older thick man, or like Pop got his first tattoo when he was like 70. Like, there's just such a variety of what's happening that like sometimes it's not always going to be in the perfect sweet spot, and that's probably what's happening here. So now all of these people have these like poop blobs all over their skin that just like they look like they have like an actual skin lesion or something, or just like a terrible tattoo. It's just but like at the same time, before you do something like that, you didn't think like, hey, can we see after pictures of what this looks like? Like, I don't know.
I mean, I would just never even consider getting something like this done. So I can't put myself in
I
their shoes.
I don't know why I'm like so shocked, like reading it today, and I just was like, and you go to a real tattoo artist and you pay the same amount. Like, it's just that I just don't even understand it. It's just weird.
Yeah, it doesn't make any sense at all.
Okay. This also doesn't make sense. The Thai restaurant that's offering discounts for skinny people.
Yeah, there's a restaurant in Thailand that has this system of metal bars. It kind of looks like a fence, but all the bars are different widths. And depending on which width you fit through is how much of a discount you get. So if you get through the thinnest one, which I don't even think I could fit my head through, you get 20% off. And then there's like a 15% off, 10% off, 5% off, and then there's, you just don't get anything for free because I guess they deem that you're too fat. So
yeah, there's what the widest set of bars is like full price. Sorry.
Yeah. So
I mean, like I was looking at that and I'm thinking like, this is so all the people are saying it's discriminatory, and it's just like, yeah, they don't care, like, obviously, and they're doing it because like we're like everybody's talking about this Thai restaurant that wouldn't have got talked about before, right? So it's just like a marketing thing. But yeah, I can't even imagine really many women that would even fit through the first one because just of boobs. It's so skinny. Like, even if you could fit your head, because your head looks like it would just fit through, right? So if you turn
I
to
don't
the
even
side
think
and you
my
have
head
any
could fit through.
well, you have like an extra big head, but like for regular people head size, it would fit through.
Yeah, I don't know.
You would probably only get 15% off.
I don't even think my head would fit through the 15% off. I'm going with the 10 to 5. But yeah, I mean, they're facing a lot of backlash online, but at the same time, they have a really high rating on TripAdvisor, so people must think the food's pretty good. I'm actually making a delicious Thai dinner. I'm going to make some tom kha soup with some nice fresh veggies.
Did you make that yet?
I'm going to make it tonight.
You never made it before?
No.
Oh, I'm curious what it tastes like.
Well, have you ever had it before?
Yeah, I've had it before at a restaurant, but I've never made it before.
So I'm going to make a vegetarian version for myself because I don't really like putting chicken in soup, but I'll put shrimp in Ricky's. But
yeah,
it seems pretty good.
All right. So again, I have a personal autopsy story with a similar situation with this next case.
Yeah, so this mom had been on this weight loss journey, and I guess part of, fluctuating with weight is that your hair could fall out. So she started taking these over the counter supplements to help with her hair, her skin, and her nails, and then she ended up going into organ failure.
So I had an autopsy years ago of a person that was in a similar situation. She just went to the hospital, was in full on liver failure, died before they could even figure out what was going on. We did the autopsy. Her liver was just looked terrible. Like it's just so jammed up. And you know, it looked so bad. It's probably one of the worst livers I've ever seen, honestly. And you show everybody in the lab and we all look at it and say like, okay, something like really gnarly happened to this lady, cuz like what the hell happened to her liver? Cuz you just don't see a liver that looks like that every day, right? Um and sure enough, like when we were investigating it and figuring out what caused her, she was having the acute liver failure and it was toxicity from vitamins. And then we found out that she was taking this saw palmetto extract that normally that would be used for like male pattern baldness, but she was having hair loss as well and she was taking it for that. And I don't know like what was in it besides that, but I just know that she had such high levels of that is what caused her to have liver toxicity and it killed her and she was young. It was a crazy case. And so when I read about this story in the news this week, this mother kind of is going through the same thing. She's on a weight loss journey and she lost a bunch of hair. She's probably on Ozempic because your hair falls out sometimes with that because you're like lacking nutrients, protein and stuff like that. Or whatever, like your hair just falls out anyway because you're starting to go through perimenopause and that's just a thing. So she started just taking a lot of supplements to supplement for the nutrients she was losing and then for her hair loss and a hair and nail one. And she started like right after she started taking this one for her hair and nails, she started noticing that her eyes were yellow, like she was turning jaundice. She went to the hospital. They thought she had hepatitis or something and worked her up for that. And then her doctor was like, "Have you started taking any new medication?" And she was like, "No." And they were like, "Did you start taking any new vitamins or supplements?" And she was like, "Yeah." And he's like, "That's it. That's what it is." Nuts, right?
Well, I think a lot of people think because supplements are considered a more holistic approach that there's nothing dangerous in them, and they're often taking them because they could just buy them at the store without consulting a doctor. And it's just really interesting because I don't think a lot of people realize that I don't know if all, but most supplements are not FDA approved. So it's really concerning how people just kind of pop them without a second thought just because they think they're healthier.
Yeah, and I think because we were talking, I think last week or 2 weeks ago about the ones that are getting sold on Amazon and stuff, which people are having issues with. Because, I mean, if you're getting it from like a brand name place, you're probably more likely to not have as many problems with it because but not really. That's even a lie, honestly. Like it's not FDA regulated. Like you don't know what the hell is in this stuff, which is a problem, and I think most people don't really have an issue with it, but you could also take too much of it and it's just it's damaging. And there are other cases. I'm going to try to look up some cases today if there was any other autopsy reports cuz we should have wrote up that one for sure cuz that was a crazy one, but luckily they're able to help her out. They also say sometimes that certain supplements could like start exacerbating issues that were already there. So if she was overweight for a large portion of her life, she might have had some degree of like fatty liver or something going on, and it could have just like aggravated that condition that was going on a little bit more, or it just was like straight up toxic to her. But she had said that it was a brand name common supplement that people use for hair and nails. They didn't say in this article the exact one, but
Well, I think maybe they didn't because
well,
I don't know if
yeah.
I saw it on her TikTok what it was. So like I know it's what it was, which is
Was that one in my cabinet by any chance? No, I'm just joking.
no, it was just a hair, skin, and nail supplement from CVS. This is of course what she is claiming. We're not saying this definitely doesn't. She had a weird complication from it,
Yeah,
but
exactly.
it
It's
is
just
important to check with your medical providers before taking anything, I think.
Yeah, and a lot of times too, like they can interact with drugs. So when you go to the doctor and they ask you what medicine you're on, you really should tell them all that kind of stuff. I think it's kind of crazy now with all the gummies and everything. People are just taking like a lot of stuff. I feel like I used to take a lot of supplements, right? And then I sat there one day and said like this is like $150 a month of all this $30 here, $30. It really is, right? And then I just stopped taking all of them one day, all of them. And like I'm the same as I was. Like I really never had one that I'm like this is life-changing, except the one I take this one around this time of year, the vitamin D, um because it's especially in New Jersey, it's been like gray since December, and then all of a sudden the sun starts coming out, and I got that weird skin thing happening when it's like April, May, June. If I have like my first real sun exposure, I get like that crazy rash and everything. So I started taking 2 of those a day, like around April until the midsummer. And it's a combination of other things, medications I'm on and things like that. But I haven't had that bad rash in a couple years. So I'm like, maybe it works. I don't know. But like other than that, like, have you ever taken a supplement that you're just like, oh my God, like this is mind blowing?
Well, I take this cortisol one that is for like I had really high cortisol and I was recommended it by a doctor and I started taking it and I do feel like I haven't had such lingering anxiety all the time like I was having. Like there was a point
It's placebo. You are
it
literally
it
the
could
same.
be a placebo. I mean, you don't know that because you don't live in my body, so
I'm the next closest thing. I think it's all like it's kind of like the biggest scam ever.
whatever. I was hearing a really good conversation on another podcast this morning actually where they were discussing how um all these holistic doctors will have you taking like 400 vitamins for mental health. Like in my case, I'm taking this one for anxiety, right? And that you don't really feel better and you're taking all these things and you're having to do stuff like do cold plunges and go in a sauna and all this stuff so you don't feel anxious all day. But there's just like a pill you could take every morning that makes you feel amazing and you don't have to do all this stuff. And I was cracking up because they were saying like everybody criticizes big pharma but nobody's criticizing big supplement. And I'm like they're kind of
No,
right.
it's true. It's true. It's like I'm telling you, like it's a scam. It's a lot. A lot of it is a huge scam, and now especially their shit is like blowing up because of social media. Because you see videos all the time, like you should really take magnesium. You should really take this. You should really, and then all these people are like, oh yeah, I should take that too. And all of a sudden, it's like they're like those supplement companies are like killing it right now. They're killing it.
Yeah, I mean, a couple of years ago, I had gotten these supplements that were designed specifically for painful periods, and like I took them for a year, and let me tell you, it did not make one fucking difference at all.
And they made how much? And how much was it a month?
A lot, like $30 a month.
Yeah, that's what I'm saying. Like it adds up when you're taking a lot of them. Like you're just like, wait a second, this is like kind of a lot of money here, and
And I think some vitamins are really good, especially if you have like deficiencies and you just need a little boost of something. But like a lot of these ones you see ads for and stuff, it's like you just don't need it. It's okay. It's nuts.
okay, so this guy decided that, his stomach hurt and doctors weren't listening to him, so he decided to go on YouTube and do surgery on himself.
I was just thinking about how ridiculous this is because when we decided to start the podcast, I was like, I'm going to watch a couple YouTube videos to figure out how to make the podcast, not how to do surgery on myself.
Oh,
It's
YouTube,
so ridiculous.
Like YouTube University is like the best for so many things.
Yeah.
Specifically, remember when like some person parked their hoopty outside of my house for weeks and weeks, and we didn't know who it was, and it just was sitting there, and then Gabe learned how to move the car up the street. That was amazing. It was just like, oh, like how to just like move a car that's parked in front of your house. It's so amazing. It's like the best YouTube University advertisement ever. But there's so many things that you go on there and like I usually get these young coconuts, and they brought me like the hairy one by accident when I ordered my groceries, and I was like, oh, I don't really know how to open this, but I want to eat it because I just never had one. I eat them often if especially like in New York when they cook them on the side of the street, which is the best thing ever. Um, but you just like look a video and it shows you how to do it real fast, and you're like, oh, cool, like just like little things like that all the time. So the
Yeah.
podcast things like normal, learn how to do this and that,
Embroidery tips.
embroidery, but like
Maybe
don't
not
know.
doing surgery on yourself.
And I guess, I mean, he wasn't looking at self-surgery videos, I'm supposing. I think he was just looking at other ones. But listen, like, honestly, like, it kind of worked. He kind of did it.
Did
I
it
mean,
though?
like,
I mean, like it does.
listen, he's alive. So I'm saying, like, he did it. And so let's say what he did. Okay, so he's 32. And he has a history of he had an appendectomy. He had his appendix removed 15 years ago. So when he was a kid, he had that removed, or a teenager. And he had stomach pain that he kept going to the doctor for, and they just kept blowing him off and saying whatever. And he was saying it was driving him nuts. So he decided he essentially was going to do an exploratory laparotomy on himself, which is he cut an incision in his abdomen on his abdominal wall to like look and feel inside to see if he could see what was wrong to remove it. Now, he could have been having pain because he could have had like a lot of adhesions from the previous surgery, which is like scar tissue. Because sometimes when you get your appendix removed, especially, I don't know if he had an open appendectomy or a laparoscopic one, but like it causes a lot of scars, and it could cause the part of the bowel to like stick to the abdominal wall, and it could just cause pain. So that's more than likely what he had going on. But he somehow like went to some market. This was in India, or
Yeah, in India.
in India. He went to like a market and he got some numbing stuff and he got a suture kit and he got all this stuff. So he goes back to his house and he starts doing it, and like he has no pain, but then the numbing stuff started wearing off, and that's when he started like screaming in his room, and his family realized that he was doing something weird in his room. I'm not sure that you would ever, you hear your kids from time to time scream from upstairs or something, and running up there, you wouldn't expect somebody to be doing surgery on themselves. But apparently he said he went inside. He didn't see anything. He felt something abnormal on his stomach, he said. And he tried to remove it and he couldn't. So he sewed himself back up with 11 sutures. And then he started screaming in pain. Like, I guess it all like, ow, like the numbing's wearing off, and this is all coming together now. So obviously they immediately take him to the hospital, and the biggest thing that you're scared of in that case is infection, because God knows what was all over his hands, if he was even wearing gloves, but they definitely probably weren't sterile, and it's just really bad to introduce bacteria into there, and who knows what he did. But I mean, he went in and he sewed himself up like old school, like back in the day, what they used to do. It was pretty amazing.
Ridiculous.
So that there's a doctor who like successfully gave himself surgery back in the 60s, right?
I've heard of this, but I just can't ever fathom doing something like that.
So he was like in the Arctic or something on some kind of expedition, and he was a surgeon, and he was having appendicitis, and he knew it, and he was just like, if I don't remove my appendix right now, I'm going to die. He had no way to get to a hospital or a doctor or anything like that, and he did it.
Wow.
Like I can't even imagine like having that conversation with a friend you're with, or what. I don't know, just like there's cases of people doing it though. It's pretty nuts, but it's cool. Like it's cool like that it can be done, but I wouldn't suggest doing it at home. And honestly, like in this case, like I know that the most frustrating thing ever is to not have your doctor take you seriously, but like taking matters into your own hands is you should kind of check someone's mental status, right?
Yeah.
To do something like this.
Definitely. This next story sounds like it's something that's going to be on that show. It's Florida Man. Remember I wrote that article about that guy that got hired to cut off the guy's toes and eat them? So this couple basically, they're feeling it coming on. They're hot and bothered, and they just had to pull over in front of this cemetery that had a locked gate. They hopped over the fence and then they started having sex on a grave. Of course,
Grave number 43.
grave number 43 specifically. So this was a historic cemetery, and I guess I guess nobody was just allowed to go in there without permission. So this cop comes across the parked car and the windows are rolled down and he's like, okay, I don't see anybody. So he starts snooping around and finds them having sex. And then he also found some meth, oxys, and Xanax
Well,
in
of
their
course,
car.
there's meth involved in this story. Really, the best part of this story was that the author of this article titled it Boneyard. And
Yeah,
then
I saw that.
and then they wrote they thought they were being dead sexy. Like, oh my god, it's so good. Some of these articles are just written so funny. So I was like, I got a kick out of that. Boneyard.
Yeah, and this next one is local to us, which it's totally unbelievable.
Dude, this one is really outrageous. The video is so outrageous.
Yeah, so this family is burying their loved one at a local cemetery in North Philly, and as the pallbearers are bringing the casket to the burial site, the platform collapses and they all fell in the hole with the casket.
Oh my god. It's so disturbing. Like, you see all of these guys in their really nice suits carrying this really nice casket and it falls. Like, how traumatizing on so many levels, but they actually got hurt. I mean,
Well, how could you not get hurt? I mean, caskets are so heavy. That's why they have to have like 6 grown men carrying them.
a casket could be like 1 to 300 pounds without a body in it.
Yeah.
And the body is literal dead weight, right? So they're all carrying it. And I mean, between that, so that probably right there is close to, it could be 400 to 500 pounds, just the casket. And then each one of those dudes could be like, 150 to 200 plus pounds. That's so much weight. Like, they need to consider that there's going to be 1,000 pounds standing on wherever they were standing. And it was like a wet piece of plywood or something.
Yeah, so they all got injured, and one guy in particular, the casket basically fell right on top of him, and then it pushed his head into the mud. So I'm sure there was like a second where he's getting crushed by the casket, and then he's probably suffocating on top of it. It's absolutely, like, this is unforgivable and unacceptable to me that this happened.
Yeah, this is definitely like lawsuit worthy in my opinion, and not surprised that it happened in North Philly. Like,
Yeah, because
some
the
of the
family
corners that get cut at some of these funeral homes are just like, come on, dude.
Yeah, and the family was saying that it was wobbly and the wood was wet and soaked. So the ground, if it had been raining, I'm sure the ground was soggy too and slippery. So it clearly just wasn't set up correctly. And how many funerals happen a day? We don't hear about this ever happening.
No, it really, it's upsetting because the guys they look nice. They're in their suits, like they're mourning whoever. I mean, if you're carrying the casket, you're like one of the inner circle, right?
Yeah.
I mean, just think about that. The family's all watching. It's just like ridiculous. When someone dies, and funeral homes have huge responsibilities, because when someone dies, the last thing you want to do is inflict even more pain on them than they're already going through.
So is that who sets it up? Is it the funeral home or the cemetery that sets up?
I don't, well, what, for the actual, I don't really know,
Like
honestly.
at the grave site, I guess I'm just curious, like who actually sets up the system which lowers the casket and the platform and everything.
I would think that that's more of the cemetery thing, to be honest. But I don't know what association the funeral home has with it too. But I really don't know. Like, that's not, once the funeral home picks a body up from the hospital, I have no idea really what happens after that. Like, just from talking to friends and things like that. But like, that's not my thing.
I don't know if you saw this either, but on the news video of this, at the very end, they were saying that the damaged wood that broke through was just like thrown off to the side after they completed the burial. So I'm like, okay, so they had to go through this horrific thing and then you're just going to leave it a mess at the gravesite? It's just so disrespectful.
Yeah, it really is.
All right, let's move on to questions of the day. Every Friday at the @MotherKnowsDeath Instagram account, you guys could head over to our story and ask us whatever you want. First, what are the differences between a PA and an autopsy tech?
Well, a PA is a pathologist assistant. That's what I am. And so we have to have a bachelor's degree and a master's degree. The master's program specializes in pathology. So it's similar, like you guys probably go to the doctor and have a physician assistant. Well, we're like a physician assistant to the pathologist. So we have a whole entire different program than the physician's assistants do, because we're dealing with organs and dead people and anatomy more than that they would be. So we have to just learn a whole different way of doing things than they would do, because we don't take care of live patients. So we don't really have any emphasis on pharmacy or anything like that, because like we're not giving patients medications, and it's just a totally different field. So when we do the autopsy, we could do the autopsy by ourselves, and a pathologist always has to really be there. Technically, they don't have to be in the room with us, but they have to be on the case, because they're the ones that are going to look at the microscopic slides that we take from them. But we have more authority to do the whole thing by ourselves without having anybody there present, because we're trained to do it. And autopsy tech is a little bit different. They will eviscerate, basically. They'll like take care of the morgue setup for the autopsy, and they'll eviscerate so they can make the incisions and take the organs out. But really, they're not trained to know what they're looking for. There always should be a pathologist or a PA with them to watch what they're doing, just because they're not allowed to take out all the organs and then like go tell the doctor hours later what they saw. They just don't have that educational requirement to be able to do that. That particular position used to be called the diener back in the day. I don't know if anybody's ever heard of that position, but now I think they call it an autopsy tech. So they're usually just side by side, especially like in medical examiners' offices and stuff, because sometimes in bigger offices there could be multiple bodies lined up in a row, and then this way the doctor could just be there and like go body to body, but not have to do all of the heavy lifting and dirty work, basically.
All right, next. In homicide cases where they used a weapon, do they leave it in the body if it's stuck?
Yes, they would. They would leave it in the body. So for example, Ellen Greenberg. Well, so I don't know, because I don't believe that the boyfriend pulled the knife out, right? I don't really remember that case, but Ellen Greenberg, she was one of the high-profile death dissections that we've covered, and when she died, she had a knife lodged in her chest still. So under normal circumstances, if no one removes it at the scene, which a regular person should never do that anyway, they would bring the body to the medical examiner's office, and then they would leave everything gets left in place. And that's for anything. Like, let's say a person got impaled by something and died. You would want to leave as much as possible for them to examine, just so they could really clearly document the injuries and exactly what caused the person to die. Sometimes, obviously, you couldn't, because, like, I don't know, if it's like a huge fence at SEPTA, you can't bring it with you. You know what I mean? Like things like that. But
all right, last. What do you guys typically do on a day off?
You want to go first?
Yeah, I mean, most of the time it's boring. Like, I'll catch up on I'll clean my house or do chores or meal prep or something like that. If it's like a nice day out, I like to go out and go shopping. Not shopping like for clothes. I just like to like go to a vintage store or a bookstore and get a nice coffee, or just like do something and walk around, because when I'm in my house all day, it like makes you stir crazy. So like,
Maria's
like
like
to get
such
out.
a townie. Like she likes going to all these towns and like trying every little coffee shop and little shops and stuff like that. That's her thing all the time, no matter what.
The coffee we had on Sunday at that place on Rowan's campus was pretty delicious, actually.
Yeah, it was good. I got a matcha and it was good. Yeah, and I don't have an exciting life either. Trust me. I cook when I take like hours to cook though. Like I like to cook really good meals, especially like on Sunday. Now that it's getting warmer out, I'll be gardening, so I'll be outside, like making my outside look awesome for a couple months. We go to Phillies games. They started. We didn't even go to one yet, but we have partial season, so we go. All of us, our whole family goes a lot. And just like we go down the shore too in the summer. Like in the winter, it's kind of like, oh, whatever, do projects around the house and stuff. Nothing that exciting. We do movies, TV shows.
Yeah, we're not very fun.
We're not. Yes, there's nothing crazy going on here.
No, I laugh because, you know, when we do the show, for example, today, I'm wearing like a nice top for the show, but I'm wearing like pajama bottoms right now. That's like what happens. Like when I work from home, I look like a total slob. And then I don't know. I think it's just this like really funny thing.
I have like, I don't know if I've ever told you guys this, but I have like I hate when people wear pajamas like in public, and it's like one of my pet peeves that I can't
Wow,
stand.
that's so surprising that you don't like that.
It seriously is just, oh my God, it annoys me. So like every single day when I wake up, I get dressed. Like the pajamas after 9 o'clock are like, no. I'm not tolerant of it.
Out in public. I mean, I wouldn't wear my pajama pants out in public, but if I'm just going to be in the house all day, then
it's the same thing as like the rule about making your bed every day.
Well, I certainly don't do that.
Yeah,
so.
You should though. There's like lots of studies done that show that people are more productive that make their bed every day. It's like
I'm pretty productive.
Yes,
so
but listen, it sets off a cascade in your mind and you don't even know it. Like once you do that, if you wake up and do that, then it's like you've already accomplished something for the day, and their studies have said that it leads to doing more tasks throughout the day. I'm just saying.
I mean, I do a lot of tasks during the day, so I don't feel really
I'd like
guilty
to add
about that in particular.
I'd like to add putting clothes on to that too. You do actually, so I'm not going to give you too much shit because you are a productive human. But I'm just putting it out there.
Thanks for putting your criticisms aside for me. It's just so nice. All right, guys. Don't forget.
I mean, if you ever tried to go in public, I would not allow it or be
First
seen
of all,
with you.
I would not do that because I don't do that. So, like, it's not even a concern for me. So, all right, well, whatever. Thank you guys so much. Please send in your entry for the 1 million download giveaway to stories@motherknowsdeath.com.
Thanks, guys. Thank you for listening to Mother Knows Death. As a reminder, my training is as a pathologist assistant. I have a master's level education and specialize in anatomy and pathology education. I am not a doctor, and I have not diagnosed or treated anyone, dead or alive, without the assistance of a licensed medical doctor. This show, my website, and social media accounts are designed to educate and inform people based on my experience working in pathology so they can make healthier decisions regarding their life and well-being. Always remember that science is changing every day, and the opinions expressed in this episode are based on my knowledge of those subjects at the time of publication. If you are having a medical problem, have a medical question, or are having a medical emergency, please contact your physician or visit an urgent care center, emergency room, or hospital. Please rate, review, and subscribe to Mother Knows Death on Apple, Spotify, YouTube, or anywhere you get podcasts. Thanks.